The University of Arizona and Arizona State University both want to withdraw from the state health insurance program. They claim it could save the universities tens of millions of dollars a year, while the state says it would cause premiums to rise for tens of thousands of employees remaining in the system. We should disclose Arizona Public Media is part of the U of A.
One of the things we're trying to do in considering pulling away from the state in terms of health insurance is to be better stewards of our resources that we receive from tuition, for example. And so with the Arizona Board of Regents' full knowledge and support, we did a feasibility study. And what we learned through that process is that the University of Arizona could save at least $20 million a year by moving to our own self-insured health insurance model.
The two universities have been part of the state healthcare program since 2004. Northern Arizona University already has its own self-funded program. Today, just under 50,000 U of A and ASU employees get health insurance through the state. They make up more than a third of the entire program. Marie Isaacson is the head of benefits for the State Department of Administration. She says the university's withdrawal would have a major impact on the state system.
The purpose of insurance is to pool our risks. So the larger our pool, the more diversified our risk is. And we do know from a study that was done, it was actually published early 2016 by an actuarial firm, that if the universities left our pool, then the cost for the state agencies based on those dollars would increase the cost for the remaining state agencies by about $35 million.
ASU and U of A say their employees are subsidizing the state system. Isaacson says that's true in part.
The U of A really is who was subsidizing, if you will, the rest of the state. And it's because the health care costs in Tucson are less expensive than, say, other parts of the state. We have a lot of employees in the rural communities. As an example, to get health care in Yuma is a great deal more expensive than it is in Tucson or the Phoenix metropolitan area.
And without the two urban universities, healthcare for rural state employees will go up even more. This is not a decision ASU and U of A can make on their own. Legislators would have to give their nod, or Governor Ducey could give the universities their wish through an executive order. And there's some time pressure. The state's health insurance plan is run in 5-year cycles, and the next bid goes out in 2019. The U of A's Allison Valancourt says the university is ready to take ownership.
Importantly, it would help us design a program that would be really responsive to the needs of the employees and the families we have at the University of Arizona.
As for how a possible move will affect university employees, Susan Stryker sees room for improvement. Stryker is a professor of gender and women's studies at the U of A and identifies as transgendered. She told our Vanessa Barchfield why the current system doesn't work for the trans community.
For members of U of A faculty in general, it's like the state health plan is actually quite good. It's a full service healthcare plan. But for transgender faculty in particular, and there are a number of us, as well as a number of U of A faculty and staff members who have dependents, who are partners or children who need to access trans-related health care. Currently, transgender health care benefits are excluded under the state plan.
Stryker says until the 1980s, healthcare coverage for transgender people was pretty good all across the country.
Up until that time, healthcare plans covered transition-related costs, but with the rise of what we call like neoliberalism or austerity, in the 1970s, as a lot of government services were being cut back. You saw these exclusions being introduced to healthcare plans, particularly state-funded healthcare plans, under the argument that this was an experimental medical treatment, or that it was not a legitimate medical need somehow. So actually, things used to be better in the past than they have been for the last few decades.
So Arizona is not really unique in this regard?
Arizona is absolutely not unique in this regard. However, many states have been moving towards, what I would call equitable access to health care for trans people. I leave it to people at a higher pay grade than me, to say what the best way forward is. But what I would want to insist on is that, there needs to be equality of access for all citizens of the state of Arizona. Whether or not people like the Affordable Care Act, it is actually the law of the land at this point, and there is a provision in the ACA that says you can't discriminate in the provision of healthcare services, and that includes not discriminating against trans people to provide, legitimate medical care for, legitimate need. So in that regard, it's like I think Arizona is a little behind the curve, that there are many states who are providing equality of access. There are many state university systems throughout the United States who don't discriminate against their transgender employees. But the U of A is still in the awkward position of being required to use the Arizona State Healthcare Plan, which does have this discriminatory provision within it. It's an inequitable situation. It's basically saying the lives of some employees are not as valuable as the lives of some other employees.
And what happens if the governor or legislators don't allow the U of A and ASU to withdraw from the state system? Is there any possibility of the state opening up care for transgender employees?
Yeah, so there could be some movement one way or the other. Whether U of A and ASU stay in the plan or whether they go, movement is possible. But what I do think will happen is if there's not some movement, that there will be a lawsuit. That there are activists who are looking for the person who could be a good plaintiff, and so all right, I will do this for the community. It's because it takes a lot of work to be involved in a lawsuit. But clearly this is the direction that things are trending. There's trans people suing for equal access to state-funded benefits are winning all across the country, because it's just clearly, it's there's a body of case law and a body of interpretation of existing law that is very much on what I would consider to be the side of justice. So it's just a question of maybe needing to work for what should be our right without having to fight for it. But you do have to fight for your rights sometimes.